Good afternoon, everyone. I hope you're doing well. Welcome back again to another webinar hosted by Generali Philippines. I am Kyle Tabones, Accounts Officer of Generali Philippines, and I'll be your host for today. So, for several centuries, vaccines have proven to be a key tool in controlling many infectious disease and preventing it from further infections. Vaccines have saved vulnerable children, at-risk adults, and the total population from an illness and even death caused by several infectious diseases, such as polio, measles, mumps, and a lot more. Preventing a disease is a lot better than treating it. Vaccines are important to keep the good health of the public. It is considered our way to reopen the world. Now, in the Philippines, vaccination against COVID-19 has started last March 2021. It is believed that the herd immunity is important to achieve in order to protect the whole population, even those who have not received the vaccine. Herd immunity is achieved when at least 70% of the population has been vaccinated. As of today, around 11.6% of the Philippine population has received at least one dose of the COVID-19 vaccine. Last week, on August 6th, enhanced community quarantine or ECQ has been implemented again to several regions and cities in the Philippines. This is to mitigate the further spread of the highly infectious COVID-19 strains, and the emerging COVID-19 variants has disrupted the plans of the world to slowly open the public spaces, the economy, borders, and others. Now, this afternoon, we are privileged to have with us a distinguished speaker to learn more about the COVID-19 variants, vaccine efficacy, and new protocols. So just a few reminders before we start our program. Everyone will be put on mute mode to hear our speaker clearly during the talking segment. You can still engage with us through the chat box below on your screen, and do feel free to write down your questions for our speaker. The live Q&A box will be open during the latter part of the talk. You can type your listed questions there, and we will do our best to answer it during the Q&A segment. Now, without further ado, let's begin our program. So our speaker for today is a graduate of medicine and surgery from University of Santo Tomas. He obtained his fellowship in Boston University School of Medicine. He served as a professor in University of Santo Tomas in the Faculty of Medicine and Surgery and Graduate School, and is a current lecturer in the Ateneo de Manila Professional School. He also served as a director for Center for Drug Research Evaluation and Studies and Food and Drug Administration Philippines. He is a former chairman of the Department of Pediatrics and current chairperson of the Research and Ethics Committee of the Asian Hospital and Medical Center. Currently, he is the president of Bioanalytica Incorporated and chief of section of infectious disease under the Division of Pediatrics of University of Santo Tomas Hospital. Everyone, welcome into our screen, Dr. Benjamin Ko.
Hello, good afternoon, everyone, and thank you for the invite. I hope everybody can hear me, and I hope you can appreciate this afternoon's lecture. Okay, let me share my screen. And okay, can everyone see the slide? Can I get a yes or no?
Yes, we can see it, Dr. Ben.
All right. Okay, so since we'll start off the short talk. I hope it's short so that you have time to ask questions. This is my nth lecture, but it's a different audience. So today's talk will be more of a laymanish type. So what will I talk about today? Well, I'll discuss the most frequently asked questions on COVID-19 vaccines and try to answer a few more questions from you later on if there are things that are not clear. I'll try to explain how some of these vaccines work and address the misinformation that is circulating about some of the vaccines and a lot of people's apprehensions on getting them. And of course, I'll discuss the data in children and adolescents, particularly when it's their turn to get vaccinated, And I got interested in the host saying that we are striving to achieve herd immunity. I was going to tell you, we will never ever do that. That's tayo. Pero nasaan na ba tayo sa pandemyang to? No, that's the most important question we need to answer. We were an economic star until COVID-19 hit the world. So everybody else has the same problem. And everybody is going through the same surge. This is where we are. This is data as of August 9. I'm sorry, August 9, because I made the slides already before the talk. So you will see that we went through the first surge in August of last year. And then we went through the second surge in March of this year. And that was a very steep climb. No? It took us quite some time before we went into an official ECQ kasi they really wanted to reopen the economy. And we are now back at another surge. I would say that with conviction that this is another surge. And it's really not good because if you compare the second surge to the current one that we have, mabuti na lang we locked down a little earlier. If you compare the second surge with the current surge that we have, notice that the second surge last March and April started from 1,500 average cases a day. So mababa yun. Here we are starting from 5,000 to 7,000 cases daily. So your baseline is higher, which means that this will peak much higher before it goes down. So what I'm telling everybody is we brace ourselves because it will get worse before it gets better. And that is exemplified with the fact that if you look at the positivity rates we've been having, even for yesterday, the positivity rate is at 21.9%. The worst that we had was March 29, 2020, when our positivity rate was 23%. And when I say positivity rate, that means out of the number of tests that are done daily, 23% of them end up positive. 1 out of 4 to 5 people tested are positive for COVID. And that's already for patients that probably have symptoms, because many of the patients who are asymptomatic will probably not get tested. And we did better. Even the surge last August, we did not go as high as 20%. But the surge last March, April, drove us back to 21.7%. The one of March 29, 2020 was really horrible. Was horrible, but not as bad as the one of March and April. Why? Because the one of March 29, 2020, we had less than 10 testing facilities in the country. They were just a handful. So we were testing only 4,000 to 5,000 tests a day. Now we are well capacitated. We have over 265 laboratories. And yet, we are not testing enough. So this is where we are as of August. You will see that our daily positivity rate is at 21.9%, which is our weekly positivity rate is at 21.9%, which is not really a very good number, because that means that patients are not being tested enough. We don't test, we cannot trace. Diba? Paano mo naman malalaman kung sinong meron kung hindi mo alam kung sinong meron? So all of the patients, we cannot do contact tracing. We don't do testing. And if you don't do testing and cannot contact trace, we cannot isolate and quarantine fast enough. So paano na ang bawat one at one? There is a difficult balance between the healthcare system and the economy. And that's a given. It's a given. Unfortunately, there are also finite resources for both the government and the private sector. It's easy for people to say that, okay, and I was in discussion with Ana Ong Lim yesterday. It's very easy for people to say, let's add more beds, okay? But unfortunately, the healthcare worker capacity is also very limited. And when you have a healthcare worker who comes down with COVID, then that means that the people that have worked around the healthcare worker will also need to get isolated and quarantined. And so that becomes a difficult problem for us because while we can give you the beds, we cannot give you the people. And that's why we need to work at creating solutions for this, like mild patients will get better care if they stay at home. So you can avail of home healthcare services, which are being offered also for COVID patients, particularly at a time when there is a surge. So we need to work at solving the problem together. Hindi tayo pwedeng kanya-kanya kasi tayo-tayo ang magkakaproblema. There should be no political endeavor in this because the pandemic does not recognize political parties. So why do vaccines work? And this is visual proof of why vaccines do more good than harm. I know that there are people that do not believe in vaccination. Unfortunately, this is our only way, one of the important ways out of the pandemic. Our only way for the current situation is to get vaccinated. And the story of all of the vaccines that your children have received or that we have received in the past is the perfect story to tell. Like way back in the 1940s, measles, pertussis, polio, and diphtheria were the predominant infectious diseases that were circulating. And when vaccines were discovered, and you'll see them, that the timeline of the discovery of vaccine are those that are in the orange circle. You will notice that there is a significant decline eventually in the number of cases. The larger circles represents higher number of cases, anywhere from 700,000 to 1 million cases. And this is in the US alone, because they have very good data. And then you will notice that once the vaccines come into play or become introduced into the healthcare system, the number of cases gradually decline over a period of time. But we'll still see eventually some of the cases spotting, which means that when they're spotty, they come out because people don't believe, they start to not believe in vaccines. They're very concerned with other issues, such as it being related to autism or that it being related to altering genetic makeups, and the anti-vaxxer groups that are on the rise, particularly with social media, promoting them and them developing platforms, make the comeback of some of the diseases. So it's important to remember that our kids must get immunized because there is always and there will always be the return of some of these vaccine preventable. So how do the 4 different approve? If you look at them, the first one is the inactivated viral vaccine, which is exemplified by Sinovac, Sinopharm, and Covaxin, which is a Bharat, vaccines, from Bharat manufacturing. And then you have the mRNAs, which is exemplified by Pfizer-BioNTech's vaccine and Moderna. I'm sure you're all familiar with these 2 vaccines. And then you have the non-replicating viral vector vaccines, which are provided on a platform of adenovirus. These are AstraZeneca, J&J, Sputnik V, and CanSino Bio. CanSino Bio is not available in the Philippines. And of course, finally, you have the subunit protein-based vaccine, which is Novavax. This has come into the picture with a lot of promotion from a pharmaceutical company bringing the vaccine in, but it still has no emergency use access. So to summarize, This shows you a table on the different mechanisms of action of the mRNA, the inactivated, the subunit protein, and the viral vector vaccines. The live attenuated vaccine is available, but we don't think that this will ever be introduced in the future. It's a weakened version of the actual virus, but because it is a live vaccine, it may cause harm in patients that are immunocompromised. So this is one vaccine that has been scratched from the picture. Now let's go through the 4 different vaccines that are available very quickly. One is the RNA. Here, the molecules, the ribonucleic acid sequence is actually used to teach our immune system to target key viral proteins. And this technology is very new. While the technology is very new, it's very easy actually to make it, but very, very difficult to store it. You need to store it at -20 to -70 degrees centigrade. The skepticism here is that it's a vaccine that has never been done before. So walang prototype siya. The other vaccine that is RNA-based and in development is the HIV vaccine. And it has not seen the light of day yet. So a lot of people are skeptical with the RNA vaccine. Fortunately, this is one of the better vaccines. And we've seen it in the billions of people that have received mRNA platform vaccines globally because of its robustness in the immunologic response of the body against some of the different variants that we're seeing today. Then there is the inactivated vaccine. Here, the inactivated uses the whole virus. So ito yung original Wuhan virus. We kill it, we kill that original, we replicate it first, and then we kill it. How do we kill it? We use beta-propionolactone and destroy or inactivate that whole cell virus. So it becomes an inactivated vaccine. We inject the inactivated vaccine into our system. It's actually one of the safest because it's a dead virus. The downside to it is that its efficacy may not be that good. So hindi sustainable yung efficacy ng inactivated vaccines, and therefore usually after 6 to 8 to 9 months nagwe-wane, mas mabilis mag-wane yung efficacy ng inactivated vaccines, number 1. Number 2, doon sa mga immunocompromised at saka doon sa mga mas matatanda, dahil ang immune system natin hindi na masyadong maganda at hindi masyadong gumagana, mas hindi maganda ang inactivated vaccine. Although there is some data that they say that it is still good, even in the elderly. As you go into a much older age group, then I probably would not recommend this vaccine to a very old age group. And the prototype for this is the inactivated polio vaccine. Hepatitis A is also inactivated. And the human cell diploid vaccine or rabies vaccine is an inactivated vaccine. Then you have the subunit protein vaccine, which is exemplified by Novavax. This vaccine uses only a part of the virus surface to focus on the immune system for a single target. And because it focuses on the most important part of the virus for protection, it cannot cause an infection. So it works almost the same way as an inactivated vaccine. And its problem is also the same as an inactivated vaccine because it may not stimulate a strong response as strong as the RNA and the viral vector vaccines. Because it will not elicit a strong response because it only uses a piece of the SARS-CoV-2 virus. This is one vaccine that is useful, but again, the population that you may want to utilize it in should be those with adequate immunologic responses. This is exemplified by the prototypes, the pertussis vaccine, hepatitis B vaccine, and the vaccine against cervical cancer and genital warts, or the HPV vaccine, are prototypes of the subunit protein vaccine. And finally, you have the viral vector vaccine. Ito yung sa AstraZeneca. No? What you do is you take the harmless virus, the adenovirus is the harmless virus, and insert the viral gene of SARS-CoV-2 into it so that it is the adenovirus, para siyang vapor, no, that brings the SARS-CoV-2 viral gene into the human body. So the live viruses here tend to elicit a stronger immune response than the dead viruses, the inactivated and the subunit. It is important to pick a good viral vector, and that's the reason why all of the viral vector vaccines have an adenovirus platform, because that is a safe viral vector. Prototype for viral vector vaccines is the Ebola virus vaccine, which is not available anywhere in the world except in Africa. And the vaccines your pets get, they are all based on a viral vector platform. And our host was talking about herd immunity. So let's talk about herd immunity. And let me talk about this with 4 slides. Let me show you this first slide, which tells you that the vaccine protects an individual. So protektado tayo. Pag nabakunahan ka, protektado ka. But there are people in the community that cannot get vaccinated yet. Children, those that are bedridden, those that are dying, those that are very sick, and those wherein vaccines are contraindicated in them for now. So the concept of herd immunity is a concept, and I don't think that will ever happen. That's why I always tell people to let the IATF to shut up and stop talking about herd immunity, because it's a concept. No, when you are talking about vaccines of different efficacy, anywhere from 50% to 95%, you factor that in. We will actually need almost 90% of the total population, of the eligible population, to get vaccinated. And then you move to another platform wherein, okay, now the kids are getting sick. Can the kids get vaccinated? Kasi yung 70% na sinasabi ng gobyerno ay sa adults lang, eligible adults. Hindi mo pa tinatackle yung 45% of the population. You have to remember that 40 to 45% of the population are 18 years old and below. So you're looking only at the 70 million Filipinos that are adults. And 70% of that is only 49 million out of 110 million Filipinos. So it's a concept. So let's talk about getting more people vaccinated. Is a better term for that. This is what it looks like when nobody is vaccinated. No? This is what happens when there is a whole barangay. Let's use that as an example. And then there's somebody that gets infected. The guy here in dark pink is the one that carries the infection. The whole barangay or your whole village that you live in are not vaccinated. Eventually, this guy is going to transfer it to everybody else. And in a few days or a few weeks, everybody else in that barangay or in that community are now infected with COVID. There will be a few that will escape it, but sooner or later, those few will get sick eventually. Now, let's take for granted we roll out a vaccine program. However, in that particular vaccine program, the coverage is below the threshold. So konti lang ang nababakunahan. And you have one whole barangay, itong mga naka-beige, yan, nabakunahan na sila. Pero marami pang ayaw. No? And that happens particularly in a local government unit. And I'm sure you all know that. You all realize that. Yung sa isang buong syudad, yung mga may kaya, magpapabakuna na. Yung mga wala, yung mga walang kaya masyado, may agam-agam, natatakot sila magpabakuna. Ayaw nilang lumabas. And most of them, particularly in the different sitios or in the poorer socioeconomic classes, nakakasalimuha pa din natin sila. So ang nangyayari, itong mga bakunado, may konting protection lang. And then you have one person that gets infected, everybody else later on, those that are not vaccinated will still get infected. And then over a period of time, those that get vaccinated, if their vaccine immunity begin to wane, they will still get infected from those that have infections which are circulating. What you want to do in actuality is you want everyone to be part of the herd. So, dapat gawin to ng mas mabilis. Swiftly, with surgical precision. What you want to do is you want to get a lot of people vaccinated as quickly as possible. Because when you have somebody who has an infection, and that person gets into the community, those that have not been vaccinated for reasons of existing comorbidities and illnesses that will not allow them to get immunized will eventually not get sick. Why? Because this person who is infected is unable to transmit the virus to other people because other people have protection. So the infection cannot spread in the population, and the susceptible individuals are indirectly protected by people who are vaccinated. But that can only happen when you have the larger majority, getting vaccinated. And I always like to tell the story of Israel. No, it's very important to tell the story of Israel because this is the prototype of a country with a population of 9 million that started vaccination. Parang tayo, nag-launch ng vaccination campaign, pero nag-lockdown din sila. Yung kwento nila, they started in December of 2020. December 2020 for their vaccination campaign. It's a small country. It's a large country. It's a small population. Mas marami pang taong Metro Manila, which is the smallest region of all the 17 regions in the country. No? And yet we have more people than Israel. They started their vaccination campaign on December 20 of last year. 1 week later, they were still seeing increasing cases. And then 2 weeks later, they went into added lockdowns. They had a very strict lockdown similar to us. Naka-ECQ din sila. If you will describe that lockdown of theirs, naka-ECQ sila. But they rolled out the vaccines as quickly as possible. It was easy. It's like Singapore. It was very easy to roll out their vaccines. Why? Because they have a very small population. Not like us. We have 110 million people. They have only 9 million. So it was easy to roll it out. And they only used one vaccine. Similar in Singapore, they only use one vaccine, Pfizer-BioNTech. And you will notice that as they began to quickly roll out their vaccines, the number of cases began to drop over a period of time until they went into full opening in March 7. It took them 3 months to contain this. And in April, they just had a handful of cases. Unfortunately, the Delta variant played a different role. So the introduction of the Delta, and 70%, they just have 60 to 70% fully vaccinated today. Now, the country that has the most number of vaccinated individuals is Singapore. With the entry of the Delta variant, what we are seeing now is that there is a rise in cases, but these are patients that may have been vaccinated, but they only get mild infections. What you want to do in patients who are vaccinated is to prevent them not from getting symptomatic disease, but in preventing each of us from getting severe or getting hospitalized. So let's go through some of the myths. No? Some people say that it's scary because vaccines are scary. Ito yung mga myths. It was rushed, it wasn't safe. We become zombies. I don't know where. I think you watch. We're in lockdown too long. Masyadong maraming kingdom ang pinanonood ninyo. It can give you COVID, it contains egg protein, it causes severe side effects. It can become super spreader event, sabi ng isang doktor sa Philippine Daily Inquirer na I think he should go into retirement permanently. And it can make women infertile. And these are myths. These are myths. The fact is that vaccine development has been with us for the longest period of time. And we have taken no safety shortcuts, and I'll show you the data in a little while. It's impossible for the vaccine to change our DNA, whatever is our DNA. Kung anong puno siya na yung bunga. Diba? It's impossible for the vaccine to change your DNA. Sana nga may bakuna na that will make our politicians brighter. The vaccine does not contain a live virus. I told you there is one that was made available, but that was never introduced anywhere in any part of the world. It does not contain any egg protein. And for most, the vaccines will cause some mild side effects, but they resolve in a few days. I mean, I have an 84-year-old mom. She was more than willing to get vaccinated. And there is no evidence that it causes infertility. Oh, wait, let me go back to that. This slide is a very important slide. The very important slide for this slide is to just show everybody that the vaccines go through what we call a preclinical development phase and a clinical phase for research and development. Like any drug, there is always a preclinical phase, and we call that in science the preclinical phase. We study it in animals first. And there are two endpoints we study in animals. One is in immunogenicity. In short, pag binigay ko yung bakunan to sa daga, sa unggoy, o sa hamster, ano bang Tagalog ng hamster? Dapat may immune response. So, sisipa yung antibodies doon sa mga animals na yun. And then, of course, the second endpoint is it safe? May namatay bang hayop during the studies? And the preclinical phase was very easy to do because all of the animals that we normally use these are the animals that we normally use during the preclinical phases, show that the vaccines work. And so we introduce it now into phase one. Phase one is we just want to find out if it is safe in human volunteers. And the safety was unequivocal, which tells you na maganda talaga ang profile ng safety ng mga bakuna to. And of course, we go into phase 2 to determine the dose and phase 3 to determine the efficacy. Does it work? So in all phases of development, safety is taken into consideration. Immunity is taken into consideration in the preclinical phase, in phase 2 at different doses, and in phase 3 on vaccine efficacy endpoints, and whether they become protective or not eventually. So what's the benefit of getting vaccinated? Well, the first one is the selfish one, which means protection for ourselves. But selfish or not, we don't want to get mild, moderate, severe, or death. Unfortunately, with an evolution of variants, it is unpredictable in getting mild and to some degree moderate COVID infections. As long as we don't get severe and deaths, which means we end up in the hospitals, I'm fine with that. Because there is no vaccine that is 100% perfect. Even if you get all of the vaccines into all your arms and legs, you will not get protected 100%. There has been no vaccine and there has been no strategy that has given you absolute protection against COVID. And that's because we all have different immunologic responses as well. So our immune system will be different from me to my sister, to my mother, to my partner, to anybody else, to my neighbor. We have different immunological responses. And then you consider also age. The best immunological response will be in the younger age population compared to somebody who's already 95 years old. But we get as much protection as we can get. So that's protection for ourselves. The selfless protection is protection for our loved ones. When we are all vaccinated, no, we protect a whole community. So when we get vaccinated, our message that we send home is that itong bakunang tatanggapin ko para sa iyo, hindi para sa akin lamang. Hindi dahil gusto ko maging protektado, pero pag protektado ko, pati anak natin hindi magkaroon. Kasi in the meantime, the kids can't get vaccinated. And finally, on reopening the economy, and I mentioned that there's a difficult balance between healthcare and the economy, and the indirect impact of health on economic revival is actually not felt by the masses. They always feel that we need to go to work. Yes, but our hospitals are full. If you go to work, you will be another statistic in the data drop of the government every 4 p.m. Do you want to be part of that statistic? Now, when we talk about how efficacious they are, a lot of people end up comparing different vaccines. Siyempre, they want to get Pfizer and they want to get Moderna. Kaya nagkaka-stampede pag available si Pfizer, si Moderna o si Astra. Pero pagdating kay Sinovac, etchepuera yan. No, we don't want, ayaw ko yan. We like the Johnson & Johnson also because it's a single dose vaccine. And then you also look at the other vaccines that are made available. The first important thing that you need to look at is sino sa kanila ang may EUA or emergency use authorization. So lahat except Novavax have emergency use authorization in the country. When we look at the prevention of symptomatic clinical disease, they vary. Bakit iba-iba? And I want to make the story very short kasi I'm running out of time. Iba-iba kasi, they started on different points in time. Example, ang datos ng Pfizer at saka ang datos ng Moderna ay galing pa noong 2020. They were the first to come out with the vaccine. And because they were the first to come out, at the time that they were doing the clinical trials, may eksperimento, yung mga bakuna sa mga tao, kukunti pa lang ang kaso. So you would expect, because there was very few COVID cases circulating in the environment, no, in the community where the clinical trial was being done, kukunti din ang magkakaroon ng symptomatic clinical disease. Unlike, for example, Sinovac, no? The 50.47% was done in healthcare workers only. Ito yung mga doktor lang, nurses, medtech, yung mga nagtatrabaho sa isang ospital sa Brazil. And that's where that data is coming from, that it is low in its vaccine efficacy. The beauty there is they're high risk. I mean, you know, you do a study in doctors and nurses who see COVID patients every day versus doing a study in manicuristas or in patients that sell insurances, they're very low risk. Okay, so if you look at these patients, definitely they eventually will come down with COVID. And the good news is that 100% of them in that clinical trial did not go on to developing severe disease, nor did they require hospitalization. So the endpoint that you need to look at is this one. We need to get vaccines in order to prevent severe disease, because the prevention of symptomatic clinical disease is arbitrary. It will depend on the clinical trial at the time it was done, the country it was done. For example, in South Africa, palpak ang Pfizer, Moderna, at hindi siya masyadong maganda din, lalo ng Astra. It was really horrible in South Africa because it was not working against the beta variant. And we see proof now also that even Pfizer-BioNTech does not do as well in Delta variants. But it will still provide you protection. Of course, our major fear is also side effects, no? Kasi Hindi natin alam kung anong mangyayari sa atin. But the most common side effects will always be local, which means pain on the injection site, redness, soreness in the area of injection. Of course, some systemic side effects will also get seen, and these include low-grade fever, fatigue, muscle ache. You know, my mom the next day after getting her Pfizer, swerte nga siya, Pfizer siya, ako Sinovac lang. When she got her Pfizer vaccine, wow, she was knocked out, down, out, and headache. But she tolerated it. It's just paracetamol, and in 2-3 days she was up and about. So the benefit of getting immunized or vaccinated is much more, and in the long run pays off compared to the short-term side effects. And the best vaccine to get will always be the one that is made available to you. Because I will always say that some protection is better than no protection at all. And this is an excellent study. This was just may COVID na hindi nagpapatest. Bakit? Kasi wala naman silang perang magpatest, number one. Number two, natatakot silang magpatest. Bakit? Kasi nga ayaw nilang ma-lockdown, ma-quarantine, ma-isolate, pick upin ng LGU at ilagay sa isang kulungan. If you wait until 40% of the population is now infected with the vaccine, that is about 80 to 90% in efficacy, and you will have 15.6 million more cases and 1.5 million additional hospitalizations. So there is no situation where it is worth foregoing the first COVID vaccine that is available in favor of a vaccine that becomes available later on in the pandemic. Now, a lot of people will have always asked me this common question, can I mix vaccines? Kasi yung iba nakatanggap na sa LGU. Pero may binili at naka-reserve dahil may kakilala na nagbebenta ng supply ng Moderna. Si Moderna lang naman ang may binilhan. You have to remember that there is a logistical challenge. I will remind everybody that the first dose, except for J&J, which is a single dose, no? The first dose always primes the immune system. So it's really not that effective. The second dose is the one that is important. It boosts our immune response to the first dose. And we should be able to actually allow and potentially boost the immune response by allowing a flexibility in the mixed dose vaccination so that when there is a shortage of supply, it can help people get vaccinated faster. And I hope the government takes that into consideration because there are some studies that show that it, in a logistical challenge, mixing and matching the vaccines can actually be helpful. And there are studies that have shown, particularly there's an excellent trial from the University of Oxford. It's called the COMCOV2 study, wherein patients who received Astra go on to receiving Pfizer-BioNTech, or Pfizer-BioNTech go on to receiving Astra, or patients who receive Pfizer and then Pfizer, Astra, and then Astra as a second dose, or receive Astra and then Moderna, or receive Moderna and then Astra and Novavax in this permutation. Okay, so the data that they have is only for Pfizer and Astra for now, and they show that maganda, pwede mong gawin. That if you receive Astra initially and then you receive Pfizer later on, the immunologic response to that is just as good as if you receive Pfizer and then you receive Pfizer later on. Actually, ang pinakamagandang combination so far is Astra and then Pfizer, or Pfizer and then Pfizer. They're still in the second phase of Moderna plus Novavax in the clinical trial. So in the Pfizer and Astra data, meron na silang datos doon. So maganda talaga if you receive it 8 to 12 weeks after. There are other countries that are doing the mix and match theory. For example, Sputnik V in Russia, and then Astra as the first dose, and then 1 dose of Sputnik V. In Spain, they have 600 participants. They finished the study. The people that received first dose of Astra and then second dose of Pfizer, particularly in the EU where they are concerned with AstraZeneca causing blood clots, or those that have adenovirus platforms causing blood clots in women of younger age groups. So they give Astra first, and then they give Pfizer as a second shot. A few questions, and so that hindi na ninyo tanungin during the Q&A. When can my children get vaccinated? Well, the US Food and Drug has only approved mRNA for children 12 to 16 years old. So wala pang 2 to 3 years old, ongoing pa yung studies na yon. So maghihintay pa din yung age group na yon. So yung mga pangamba na baka pwede nang isaksak yung anak ko. Ako, mommy, daddy, marami pang adults na hindi nababakunahan sa Pilipinas. And the current situation is that children won't get COVID if adults don't get COVID. So we should get vaccinated first. Hindi yung isasabak mo yung anak mo, yan, no? Tatay, ikaw, bakunado ka na. Hindi, pwede na itong bata. Pwede na. So, ginagawa natin, alay yung ating anak muna. Kasi natatakot tayo. So let's get vaccinated first before we get the children online. Because some of them, while the data shows that children will 100% actually yung clinical, yung vaccine efficacy in the pediatric data for 12 to 16 years old. That's because I explained that to you. Magandang immune response parati sa bata. And we expect them to respond very well to the vaccines compared to us. No? But the side effects are the ones that are troublesome. For the mRNA, pericarditis and myocarditis, which are complications, cardiovascular complications, were seen in young males. And the adenovirus platforms naman, we see blood clots in young females. So we're a little careful in making full recommendations for the pediatric population now. That's the second reason, aside from the fact that the first reason is that not everybody is vaccinated yet. So the Delta variant are now sending children to the hospital, but the question is, are they sicker? They are not. The vaccines are effective against Delta, and they provide powerful protection against severe disease, although it may be a little lower in efficacy compared to the Wuhan original virus or the Alpha and Beta variant. A lot of children are not yet eligible for the vaccine. So as more and more adults get vaccinated, then children will make up an increasing share of COVID cases. And we know that the Delta variant is known as the variant of the unvaccinated. And that's the reason why the children are the unvaccinated group. That's the reason why there is a clamor for them getting vaccinated as well. In the meantime, dahil 12 years old and above pa lang ang approved, yun pa lang ang pwedeng bakunahan kung may bakuna na available for them. If I get vaccinated, can I go back to what I used to do? Sadly, no. You still need to observe minimal health standards like masking, distancing, avoiding crowds, staying in ventilated spaces, and hand hygiene. As more people get vaccinated, the virus also evolves. You have to remember the virus is a cell. Now, and like all cells in our body, each and every cell attempts to survive, even oncogenic cells. Kaya yung mga cancer cells, kung minsan, di ba pag may cancer yung mga tao, yung mga cancer cells, nag-overtake sila doon sa mga cells na non-cancerous. Why? Because the cancer cells attempt to survive. Ganon din yung mga variants. No? With SARS-CoV-2, they will mutate because they live in a world wherein their survival is also essential. So as more people get immunized, those that will come down with COVID infections are those that are vaccinated, because there is no vaccine that is 100%. But the difference will be in the symptoms. We will just get mild infections, and the majority, most of us, will not go into severe or critical cases. No vaccine perfect, no human being perfect. So while vaccines are standard, unfortunately, our bodies and immune systems are not calibrated the same way. So here's a perfect example. These are 3 different studies in 3 different countries. The first one is in England, the second one is in Canada, and the last one is in Israel. The circle here in gray is the Alpha variant. Ito yung UK. Meron tayo sa Pilipinas, ang UK variant. So if you look at the mRNA or the Pfizer vaccine, which is used in these 3 countries, the Pfizer vaccine is over 90% effective in preventing confirmed infection, in preventing symptomatic disease, and in preventing hospitalization. In any of the 3, whether you're any part of the world. So maganda siya. Unfortunately, with the Delta variant, the data shows that in England, it is only 79% effective in preventing confirmed infection, 88% in preventing symptomatic disease, but it is 96% in preventing hospitalization. As good as preventing hospitalization if you got the Alpha variant. And you see the same story in Canada and in Israel. No, it does not work very well with the Delta variant. Bumababa in efficacy, in confirmed infection, and in symptomatic disease. But in hospitalization or death, it is still a good, decent number. So sino ang pwede magbabakuna? Practically everybody. No? The only times na pwede mong ipagpaliban muna yung bakuna is if you have COVID, you got exposed to somebody who has COVID and you are in quarantine. Those that have been treated, that means that you receive convalescent plasma or monoclonal antibodies in the last 3 months. Those that are in the first trimester of pregnancy, wait until the second trimester of pregnancy before you get vaccinated. Those that are admitted in the hospital and have comorbidities or have ongoing illnesses that will require treatment to their infections or to their underlying comorbidities. And those wherein you need clearances are those that have autoimmune diseases, HIV, cancer, those that have undergone transplant, on steroids, or are bedridden. And of course, those that cannot get immunized are those that do not fulfill the age group, those that have allergies to vaccines, and those that have a reaction to the first dose. I think that's my last slide. I will end with this. Lahat tayo may pangamba. We will never be able to fight and achieve fighting this pandemic. We all do it alone. Yung sarili na lang natin ang tinitignan natin. But when we work together, we can defeat an enemy that has claimed lives, ruined economies, changed the way we live, we breathe, we enjoy the spoils of life. We're all stressed, not only with Zoom meetings, we're stressed with having to go out, with the mental health, not only of ourselves, but of our children and our loved ones. That's the reason why when we get vaccinated, let's all remember that we're not doing this for ourselves and that we're doing it for others. And that we practice the minimum health standards and safety protocols and make sure that everybody gets vaccinated and encourage a lot of people to get vaccinated. Because at the end of the day, this pandemic will still come to an end. And when it does, that's the story we need to tell. Thank you.
All right. Thank you for that very detailed presentation, Dr. Benji. It's great for us to know more about the details on what's usually the basis in issuing the lockdowns, no? And the efficacy of the vaccines as to what are the pros and cons per vaccines and the safety parameters we took into consideration in procuring these vaccines, no? And of course, especially for debunking the herd immunity myth that you mentioned, as this is usually what is currently or commonly stated in the media outlets. So everyone, now we are activating the live Q&A box to accommodate your questions for our speaker. Please write down your questions in the Q&A box found at the bottom of your screens. So to start it off, Dr. Benji, we have two questions here from Mayo and Grace regarding the booster for vaccines. So they're asking if the booster is a prescribed vaccine after the two dose. If so, how many months after the second dose will the booster be recommended, if it's recommended?
There's no recommendation for boosters. I know everybody that got Sinovac wants to get another shot. So the answer to that question, for all the questions that are asking, I got Sinovac and I get another shot. The answer to that question is, if you bought the next shot, go ahead, get it. So if you ordered Moderna, fine, go and get Moderna. Basta binili ninyo, huwag ninyong kukunin at huwag niyong dadayain ang sistema ng gobyerno kasi that is unethical. Maraming naghihintay at marami pang hindi nababakunahan. Hindi lahat ng karayom dapat nakasaksak sa katawan natin. And I told you that already. No matter how many shots we get into our system, kung ang immune system natin, ganito lang yung reaction, ganito lang yung response, kahit isaksak mo lahat ng bakuna available in the world sa sarili mo, it's not gonna work. Okay? May hangganan yan. Kasi you also have to consider the fact that because the vaccines are coming from different platforms, there is a possibility that it can stimulate an autoimmune response that is irreversible. So that can be a side effect that will be, our immune system becomes haywire, and we call it an autoimmune reaction, and that will be lifetime. Imagine, just to get protected from COVID, you get a lifetime disease. It's not something that you want. So there is currently no recommendation for getting a booster. That's one. The second is locally, if one is made available because you bought the vaccine, you can go ahead and get it, although there is no evidence that you can. It just so happens that other countries in the world, like the US, the UK, if you get Sinovac, they will tell you to get Moderna or Pfizer BioNTech's vaccine or AstraZeneca when you reach their country. So there is no science behind it. It's just that they don't trust the data for Sinovac. They don't trust the data for Sinopharm. They don't trust the data for Sputnik V, and so on and so forth. Okay.
All right. I hope that clarifies the booster questions, no, that we have, since we have a lot of questions regarding that matter. Now, the next question, Dr. Benji, aside from the vaccines, what is your opinion of the medicines like ivermectin?
You know, ivermectin is a good antiparasitic. My dog takes ivermectin. And I give it para he does not get worms. Now, there is no data yet for it being very effective against COVID. If you want to take it, then that is something that you risk on your own. It is not part of the recommendation. There is no definite action on SARS-CoV-2 SARS-CoV-2 except in the laboratory. And in the laboratories, you needed very high doses of ivermectin in order to inhibit the growth of SARS-CoV-2. You have to also remember that the number one side effect of ivermectin is neurological. When I say neurological, may warning yun, no? Pag binibili mo para sa aso mo, nakalagay doon, if your dog has seizures, lalo magkukumbulsyon yung aso mo. So if you want to take the ivermectin, that's AYOR at your own risk. I'm not closing the door on it. It's just that I wouldn't even give it to, I would only give it to my dog to prevent worms.
All right. Now, moving on. In regards to the efficacy of the vaccines, is there any correlation in regards to race? So, for example, will the Filipinos respond well to a vaccine versus the Indonesians?
Well, I think we will all respond well naman, whether you're Indonesian, whether you're Thai, no. And the reason why you are seeing more cases now in Thailand, we're seeing more cases now in Indonesia, we're seeing more cases now in Singapore, and even the healthcare workers are getting sick. It's because there are more cases. Well, let's face it, mas maraming kaso ngayon. Look at Thailand, they've hit 20,000. Look at Japan, di ba? They've hit 20,000. Malaysia. Kaya mas maraming nagkakaroon na healthcare worker kasi nasa surge sila. Di ba? Hindi sila sanay na nagkaka-surge. Di katulad ng mga Pilipino, sanay na tayo sa surges. So sila, pag nagka-surge, ganun din naman sa India. Hindi naman sinabi na pag nabakunahan ka, hindi ka natatamaan eh. Sabi nga ni Nora Honor, walang himala. So, walang himala talaga. Ang dahilan kung bakit tayo nagpapabakuna is we want to get protected to a certain degree, and that protection should give us enough room and enough leeway that we do not get severe or critical illness, so that we do not get hospitalized. We can come down with something like a flu-like symptom. Stay at home, it's like getting a bad cold, and then recover on our own.
All right. So I hope that clarifies it, everyone. Moving on. With the projected rise of confirmed cases, do you think the ECQ will be extended up until September?
Hindi ako IATF member. Pero kung ako yon, I probably would extend the ECQ for a month. Considering the fact that our numbers are very high and that we really need to bring it down. You know, the second surge, the one last March and April, was quite easy to handle. You know why? Kasi we only had NCR bubble, the NCR plus bubbles, Calabarzon, NCR, Central Luzon. Yun lang, doon lang nag-surge. 94% of the cases were coming from there. Now, no. 50% of the cases are from NCR, Calabarzon, and Central Luzon. The remaining 50% are from the Visayas and Mindanao. So it is all over. At dahil it is all over, we have very leaky borders. We have 7,641 islands. Anybody can just swim from one island to the next island or row from one island to the next island. Tingnan mo naman yung mga vapor na dumadating. Di ba nagdadak, hindi naman natin alam kung sino bumababa. Yung pala yung buong barko, may COVID. That's where we are.
Okay, so I hope that clarifies in the current state that we have for this third lockdown, no? So moving on, is it true that Xenovac is not effective for the Delta variant? And those vaccinated with this vaccine,
we don't know because Delta does not have Sinovac has no data on Delta. But like I said, you know, if whatever is available there, wag na kayo mamimili pa. Ay, Sinovac yan, hindi yan maganda sa Delta. Paano kung yung nag-circulate sa community ninyo, yung Alpha? Di ba? O yung Wuhan, o yung original. You have to remember that the Philippine Genome Center can only sequence a few a day. And that's the reason why the data comes in very late. The data on the Delta variant, the cases, is 2 to 3 weeks behind. Ganyan katagal. Because we have only one place that sequences. So you presume na may Delta variant. Ay, kung mamimili tayo kung anong bakuna ang gusto natin, sayang naman yung mga bakuna. No? Kasi kulang na kulang talaga. At yan lang ang pinoprovide ng gobyerno, yung mga hindi naman natin pwedeng bilhin kasi naka-EUA siya.
Definitely agree on that, Dr. Benji. I'm also Xenovac. So moving on, what are your pre and post-vaccine to do or don'ts?
Post-vaccine, don't go out. Ako, alam mo, simple yung buhay ko. Kung hindi mo kailangan lumayas, huwag kang lumayas. I know a lot of people like to, pwede na tayo mag-dine in, sabi ni Miss Piggy from the Palace. No? Sa akin kasi, hindi yun eh. I know we like to prop up the economy. No? We love to do that. We love to prop up the economy. We need to do that. But we can help them naman by ordering. Kasi I've never eaten out. I've never dined in short. Because I don't know if the next person beside me is vaccinated. Alam naman, Miss, ano ba? Bakunado ka na ba? Di ba? Hindi mo naman pwedeng gawin yon. So we presume that everybody else is not vaccinated until proven otherwise. That's the most important thing. And while we like to remove our face shields and face masks, we can do that at home. Especially if we're all vaccinated. We make sure that our circle is vaccinated. So you create your own bubble. That's the most important thing. You create your own bubble. Lahat ng mga katulong ninyo, lahat ng driver ninyo, lahat ng mga yung pabakuna nyo, yung mga nasa bahay ninyo. Kasi kung kayo lang, tapos yung driver ninyo, araw-araw uuwi, mag-uuwi yan din sa inyo ng COVID. And it's a good advice also that you don't let kasi like kami, my mom kasi is 84. She is person with disability. Tapos she is post-operative from cancer 2 years ago. And we don't make the caregivers go home. If they do, they take turns. But when they return, they have to go into quarantine, and then we do PCR testing or we do swabbing, antigen swab regularly. So, but always keep a distance, stay mask. If you don't need to go out, don't go out. And when you do go out, lahat ng errands mo for the day, gawin mo na. Like me, I go to the hospital every day. Diba? So lahat ng gagawin ko sa hospital ko, nakakalibrate yan. Lahat ng clinic ko umaga lang. Wala akong clinic sa hapon.
Okay, thank you for that, Dr. Benji. And then another is regarding the face shields. So if you're a vaccinated individual, is it still recommended to use the face shields since we're the only country that implements this?
I love you for asking that question. I don't believe in face shields. You know, this virus is transmitted. I don't care what other people say. But this virus we know is transmitted through 2 routes, no? Droplet and airborne. And when it is airborne, that means it is circulating. It's like when you say it's airborne, people say, oh, ano ba yan? Nagpa-flutter in the air. It's like smoking. No? Pag may naninigarilyo, naaamoy mo yung sigarilyo, it stays there for quite some time. So ganun din si SARS-CoV-2. So it stays in the air for quite some time. Eh magpa-face shield ka naman, butas dito, butas dito, butas dito, butas dito. So what's the use? Diba? Mag-double mask ka na lang. Mas effective pa.
I see. Thank you for that clarification, Dr. Ben.
At madadapa ka pa. Dapa nga ako eh. That's one of the reasons why I hate face shields.
Yeah, it's very distracting sa face.
It glare yung light. I did not see a step, I fell. Mabuti na lang nasira yung face shield at that moment.
So another question, Dr. Benji. If you're vaccinated, can you still transmit the disease?
Yes, if you get sick. It's like getting flu. I get vaccinated from flu, but I come down with flu, then I am still contagious. Okay. Unfortunately, that's the case. So that's the reason why if you get sick with COVID, at least it will just be mild, but you are still contagious. The mere fact na nagkasakit ka eh. Diba?
Hmm. So for our last question, Dr. Benji, if you got infected by COVID, how long should you wait after you take the vaccine?
2 weeks after recovery. So you must recover. So when you are considered recovered, you can get the vaccine already 2 weeks after. Actually, alam mo, in my talk last night sa mga doctors, maganda nga, there's one beautiful study that was published. And it's an excellent study. It's one of the excellent studies that show that if you have had an infection, your antibodies are actually way up there for quite some time. Kaya bihira ka nakakakita ng yung mga nagka-COVID ulit. I did not say hindi. I said bihira ka makakakita. Ang pinakamaganda, pinaka-robust na antibody response ay yung mga nagka-COVID na kesa sa bakuna. Kasi mas specific ang antibody response, ang immunologic response to those who develop COVID than those who just got the vaccine. So I'm not saying na sana magka-COVID na lang tayong lahat kasi yun, mas protektado tayo tapos magpabakuna, mas sustained yun. Actually, ganun na nga yung study na yun. Dahil mas maganda talaga ang antibody responses ng mga nagkaroon ng sakit.
Okay. So thank you for that note, Dr. Benji. And for everyone, especially to those who we weren't able to answer your questions since medyo marami talaga yung questions. No? So sorry we weren't able to accommodate all of it. But yeah, thank you, Dr. Paul, for helping us to know more on the identified COVID-19 variants, efficacy of available vaccines in the market, and ways to continue the safety of everyone against COVID-19. So our attendees have definitely gained valuable information in our continuous fight against COVID-19. We truly appreciate you taking the time for this webinar. So to wrap this all up, may we call on screen our Medical Director for Generali, Dr. Marian Lopez.
Hello. So on behalf of Generali Philippines, I would like to thank Dr. Benjamin Ko for that very informative lecture. So I know that we all learned something more about COVID variants and vaccines and how we can protect ourselves against this great disruptor in our lives. So we at Generali continue to be your partner during these trying times, and we will continue to provide coverage to our members. But get vaccinated now and don't forget the basics. So wear your face mask, not face shields, only when you go out, so you avoid being chased by the security guards and policemen. So wash your hands often, disinfect, stay at home, and limit our movement to what is considered essential. Thank you and stay safe, everyone.
Thank you for that, Dr. Lopez. Thank you, Dr. Benji. So that's it, everyone. On behalf of Generali Life Assurance Philippines, thank you for joining us today, and we look forward to seeing you again to our next webinars. Once again, I am Cal Tabones of Generali Philippines. Thank you and enjoy the rest of your day. Thank you, everyone.
Thank you, everyone.
Value most in your life.
Thank you, Benji.
Your family,
Thank you, Jean.
your friends, your career. Where do you spend most of your time? At home? At work? Online shopping? No matter how big or small your priority is, you can be an influence who make a lifetime impact to the people you value the most, to the things you care about, and even to the places you step into. Generally, our priority is you. Taking care of people is a tough business. Companies thrive and succeed based on how happy, productive, and excellent their people are. We know this is your job, to help companies take care of their people because people take care of their companies. We hear you and believe in you. Our commitment is to be your lifetime partner in securing the future and lives of the people, your people that you value. Because what you value is important to us. We take every opportunity to intricately learn and administer ways to help you provide the best solution to improve their welfare and to progress in life. Over the years, Generali has grown to be a leading life insurance company anchored in the preserved Italian culture that has brought its fruit to various international countries, including the Philippines. Today, we continue the legacy committed to being your lifetime partner as you become your company's partner in enhancing the lives of your people through these customer-centric products and innovative services. Ease your worries on what might happen through group life insurance. Have your employees be health secured with a comprehensive medical coverage. Worry less now with the group health insurance. We will never know when an accident might occur through the group personal accident. Reduce the risk of having unpaid loans through the group credit life. Worry no more when your employees get diagnosed from any of the 21 identified critical illnesses through the group dread disease. Moving forward, you can now easily access our products and services right at your fingertips through our digital platform. Generali wants to take care of you by helping you take care of the people around you. Our commitment to deliver on the promise that we are your lifetime partner that you can trust and rely on will continue.
All of this we're doing to attain our aspiration to become a lifetime partner to our customers, distributors, and employees. This is our commitment and we will stay true to it.